we can start now. You have 10 minutes. When the 2 minutes
Yes, sir.
remaining, I will give you the indicator.
Yes, sir. So I'll begin, sir. So
Yeah,
good evening.
yeah,
Myself, Dr. Ram. I am the senior house officer of the medical unit on duty.
yes, doctor.
So, are you Mrs. Sarah, the daughter of Mrs. Rabata,
Yes, doctor, I'm Sarah.
sir?
Yes, I'm
So, do you
Sarah.
have the consent from? Yeah, do you have the consent from your mother to discuss regarding your condition?
Yes, doctor, I'm the next of kin of my mother, and she told me to discuss with you about her condition.
Yeah, good. So, my agenda for today is I'd like to discuss about the recent treatment you received and the side effects you experienced due to that treatment. And I will also discuss about the plan of moving forward.
Okay, doctor.
Am I clear?
Yes, yes.
Yeah. So your mother presented with symptoms which were suggestive of giant cell arteritis, which
Okay.
could lead to a serious complication like vision loss if left untreated. So based on the initial findings,
Yeah.
we thought that we could start on high dose steroids
Mm-hmm.
to prevent the such a complication of visual loss until
Okay.
the diagnosis is confirmed.
Right.
So we did further testing to confirm the diagnosis. And
Mm-hmm.
based on the further testings like imaging and blood test, we have ruled out the giant cell arteritis. So this steroid can be life-saving in certain conditions, but
But,
unfortunately,
but doctor, how you started the treatment without confirming the diagnosis?
yeah, I appreciate your concern. So this treatment was given in the best interest of the patient. So if we delay the treatment, there was a chance for visual loss. So we proceeded with the treatment.
So you
I
said
appreciate your
some you said something like giant cell arteritis. What is this condition?
So this is a condition which will affect the large blood vessels which supply our eyes. So if left untreated, it will lead on to a permanent visual loss. If we
Okay.
start on a steroid early, there is a chance for preventing this. That's why it is started.
Okay. But
Mm.
doctor, after starting this treatment, my mother, she became confused and agitated, and she is now in distress.
Yeah, yeah, I appreciate your concern, Mrs. Sarah. I apologize for the inconvenience. So this was done in the best interest of the patient. Unfortunately, she developed this complication, which is very rare.
No, doctor, I'm not understanding what you are saying. How could you start such a heavy medicine or such a dangerous medicine without making the diagnosis?
Yeah, yeah. So while starting the treatment, we have to look on for the risk and benefit. So we tried to give the best for the patient.
Mm-hmm.
And based on the present scenario, we thought that the starting the steroids would be in the best interest of the patient. That's why we went on with the drug, even before confirming with the diagnosis.
You don't have any other option? You could not give any other medicine?
Yeah, at that scenario, there was no other option left. I appreciate your concern, but there was no other option left.
No, no, doctor, I'm sorry. How the medicines are finished, now the world is very advanced and we have different options. For every disease, we have different options. So how you selected this medicine?
Actually, yeah, I appreciate your concern. This steroids can be life-saving on certain conditions, and in this condition, it will be a life-saving drug.
But
But
I feel,
unfortunately,
is it the life-threatening condition? You said joint cell arthritis. It is life-threatening condition?
yeah, if left untreated, it would have been life-threatening, and should have.
Okay,
It can have a various manifestations starting from visual loss.
okay.
That's why
Okay.
we proceeded with the drug with the best interest of the patient.
So why I did not inform these complication before starting this treatment to my mother?
I appreciate your concern, but this is a very rare side effect, and yeah, we did not expect this. I apologize for this.
Okay. So, doctor, because of this medicine, really, my mother is suffering. So, what you will do now?
I understand how distressing this experience has been for you and
Yeah.
your beloved mother. This must be very challenging for you people to accept it.
Hmm.
I'm here to address your concern. The good news about this is, if you are there is a chance for reversing this confusion
Okay.
once we stop the drug. So our plan will be to taper the drug and stop it. Once we stop the drug, there is a high chance for recovery. It is a reversible condition.
So how long it will take to be reversed?
Yeah, so it will take from 1 month.
1 month. So she will remain confused for 1 month, doctor?
No, so as soon as we start tapering the drug, she will start to regain the consciousness. Till that, she will get all the required support from our team,
Okay. So
and she will be close. And she will be close.
you
Yes,
will
madam. Yeah,
you will do the tapering of the medicine?
yeah. I will discuss with the consultant and will carry on with the tapering of the medicine.
Cannot we stop this medicine immediately?
No, if this is regarding, I appreciate your concern, but regarding steroids, we can't stop the steroids immediately. So it will be deleterious for the patient. So the usual procedure is we have to taper the drug and stop it.
Okay, doctor. So
By stopping the drug is spontaneous. Yes, sir. Yes, ma'am.
okay,
Yes, ma'am.
okay. So doctor, you did the mistake. So I want to launch a complaint.
Yeah, I appreciate your concern. You can lodge a complaint with the management team. I
Mhm.
will provide you with the details if you want to proceed. So,
So what is the procedure to proceed for complaint in your hospital?
oh yeah, we have this adverse report form. So
Mhm.
any adverse effect to a drug will be recorded and it will be proceeded to the in-house management team. So they will assess it and try to prevent this complication in the future.
So the next time you will not use the medicine to any other patient.
Probably yes. Yeah.
Okay. Okay, doctor. So
Yes, sir.
you people have done the biopsy and you told me that she is not suffering that disease that you were mentioning before, right?
Yes. Ma'am. Yeah.
Okay, this is good news, doctor. Thank you so much. So,
Thank you, ma'am.
okay,
I once again apologize for the inconvenience. Thank you,
okay,
ma'am. We will be
okay.
there to support you throughout the course of recovery.
Right, okay, doctor. So you have
And we'll
2 minutes remaining, Dr. Arvind now. You want to do something more?
yes, sir. I want to reassure the attender once again, sir.
Okay, continue.
Yes, ma'am. So we will be providing the support both emotionally and physically until the patient requires, ma'am. The patient will be continuously monitored and the dose will be tapped carefully.
Here other page marks on. Okay.
Yeah.
Yes, doctor.
Thank you.
Are
Thank you,
you
ma'am.
just continue, Dr. Arvind? You see what
Oh, sir.
skills are checked. You see the screen now. What screens are is
Yes, sir.
showing is you have like communication, you have concern,
Yes,
you
sir.
have clinical judgment, you have welfare. You want to do something
Yes,
more
sir.
about this? Can you
Sir,
can you do something more in the welfare of the patient?
yes, sir. I can arrange ambulance for the patient to reach home, sir. Uh,
Okay.
if the patient
She does
if the
not
patient does not got
she does
own vehicle.
she does not need actually.
Yes, sir.
Okay, no problem. Just continue. Just focus. Still, you have 1 minute remaining. So just focus. Can you ask something more?
I can ask about who is taking care of the patient, sir, and who is supporting them financially, sir. So
Right.
because
Okay.
financial
So
aspect will affect for all.
yes, yes, doctor. She's living alone, and I'm living with my husband in a different area. It is like 30 kilometers away, and I used to visit my mother
Yes, sir.
every weekend. So how she can be managing the situation in the house? Would you please arrange something for the patient?
Uh, I
Social
can
care.
arrange for a social worker to help us.
Okay. Anything else? You still remaining 10 seconds?
Sir, I think I did it, sir.
Okay, thank you. Time is up.
Correct me if I'm wrong, sir. Yeah.
Okay. Okay, Dr. Arvind. During
Yes,
the scenario, I should be like this, or should be more aggressive, but as a new performer, so I was
yes,
not
sir.
that much aggressive uh,
Yes, sir.
during the interaction. So usually you
Sir.
can face the situation like this during the exam.
Yes, sir.
Okay. So I will give you the feedback about your presentation.
Yes,
So
sir.
you introduce well
Yes, sir.
yourself and you ask me about my relation with the patient. Okay.
Yes, sir.
The next step is usually what we have to do is we have to explain the agenda, why we are here today.
Yes, sir.
This should be our approach. So you can do like this. We are here to discuss the health condition of your mother. Is that all
Yes, sir.
right? Okay,
Yes,
so
sir.
you did the right introduction. You asked the next of kin the permission. That is very nice. The next step
Yes,
is
sir.
explaining the agenda. So we should be on board that what is the agenda of meeting today.
Yes, sir.
So next time when you do, so you make your structure like this introduction, and then
Yes, sir.
the if it is not the patient, it is the relative, then we have to ask about the next of kin, the permission is
Yes,
taken
sir.
or no. Okay, and
Yes, sir.
then the next structure in the structure is next point is explain the agenda, and then you have to ask the background of the condition of the patient to the relative or
Yes,
the
sir.
patient. Okay, so it will save your time, and it will
Yes, sir.
it,
I'm not getting this point, sir. After the agenda, we have to ask about.
the background of the condition of the patient.
Yes, sir. Yes, sir.
Like in this patient, you can ask me as a Sarah, can you please tell me
Yes, sir.
what you know about your mother condition?
Yes, sir. Yes, sir. I have to ask what they know. Yes, sir.
Yeah, so in that condition, she will be telling you that my mother is suffering from some orthopedic condition for last 6 months. Okay,
Yes, sir.
and 2 days ago she develops severe headache, sudden headache, and then the doctor, as a doctor, your team started the high dose steroid. Okay, and today
Yes, sir.
morning she became confused, and I'm very much distressed, and patient is also confused and agitated. So what is
Yes,
going on? Okay, so
yes, sir.
in that scenario, you will not do this all from your side. Actually, the communication skills is the two-way
Yes, sir.
discussion. So we have to involve the relative of the patient or the patient from the beginning. Okay, and we have to continue our discussion from that point to onward.
Yes,
Is
sir.
it clear now?
Yeah, yes, sir. Yes, sir. We have
Okay.
to. Yes, sir.
Okay. Now, so then she was started on a high dose steroid. It was in the best interest of the patient. You are right. Okay.
Yes, sir.
And why we started? Because it is recommended in national and international guidelines that you
Oh,
have
yes,
to
sir. I have to.
mention like this. Okay.
Okay.
And then the next point is, uh, what is the giant cell arteritis? Giant cell arteritis is a condition in which the blood vessel uh, that is the one of the biggest blood vessels is affected, having got the inflammation. Okay,
Yes, sir.
and this inflammation cause threatening to the light. It will cause threatening to the other temporal artery also and other blood vessels. You can say the other blood channels. So
Yes, sir.
it is not the threatening condition, but it is causing threaten to the
Yes, sir.
vision of the patient.
Yes,
Is
sir.
it clear? Is this clear?
Yes, sir. Yes, sir.
Okay. So, according to the guidelines, once
Yes,
the
sir.
giant cell arteritis is suspected, we have to start the treatment immediately. We do not delay. Okay.
Yes, sir.
If
Mm.
we delay for few hours, if we delay for
Yes,
few
sir.
hours, patient can develop blindness. So the blindness
Yes, sir.
would be permanent. Okay.
Yes,
So
sir.
this medicine is well tried and tested before in this condition. Okay.
Yes,
This
sir.
is another point to favor your medication.
Yes, sir.
Okay. The next point is it was started by the consultant in the best interest of the patient.
Yes, sir.
Okay. And it is
Yes,
not
sir.
the mistake to start this medicine.
Yes, sir. I have to add that point. Yes, sir.
It is not a mistake. In this condition, it is not a mistake. Okay, I
Yes, sir.
will partly stop this recording.